New at 10, a major development in the East Bay. Sutter Health has announced plans to open a $1 billion medical campus in Emeryville. The expansion will feature cutting-edge facilities and comprehensive health services. KTVU's Betty Yu live at the future site of this new campus. Betty.
Claudine, Sutter Health says that this new campus will really be transformative for the East Bay. Now, this is one of the existing buildings behind me that will be a part of this new medical campus set to open in 2028. The new hospital will eventually replace the Alta Bates campus on Ashby Avenue. This lot on 53rd and Horton Streets in Emeryville will turn into a brand new flagship Sutter Health hospital with at least 200 beds in 2033. It will include emergency services, an ICU, and private patient rooms. Two existing buildings nearby will house outpatient services and specialty clinics in 2028. The goal is to serve more patients in the East Bay and beyond.
Emeryville was selected because of this ideal campus. 12 acres, 2 buildings to provide ambulatory. We really want to be able to improve access for patients to make appointments, get the most advanced care possible in the time that they need it. Right now, across California, a lot of patients are waiting for appointments.
Sutter Health's plan is to ensure patients can access comprehensive care within a 15-minute drive from home or work. It plans to hire at least 100 doctors and clinicians.
When we talk about state-of-the-art facilities, we're talking about advanced imaging care, advanced operating rooms. We also can provide advanced ambulatory surgery programs, and then also in the clinical space be able to provide services, procedures, care with really the latest technology.
The new medical center will replace acute care services at the Alta Bates Ashby campus in Berkeley. Sutter Health had said it intended to close the hospital by 2030 because it's out of compliance with the state's seismic safety standards. After the move to Emeryville, the Berkeley site will be repurposed as an ambulatory surgery center, urgent care clinic, and possibly a skilled nursing facility. The city of Emeryville said it welcomes the new development, as Sutter Health will be the city's largest employer.
I think that the very fact that it's going to bring, it's likely going to double the employment, the traffic coming into our city. So I think it's definitely going to be a very good economic stimulator, definitely for new businesses as well as the existing businesses.
And Sutter Health says that it currently serves about 480,000 patients, and with this new campus, they can nearly double that to about 800,000 patients. Claudine?
Yeah, certainly exciting news, Betty, but if we can just narrow down the timing a bit. You said that new campus is set to open partially by 2028, but not fully until 2033. Alta Bates in the last timeline was set to close in 2030, which begs the question, what happens in those 3 years before that new campus is fully operational?
So Sutter Health says that it does expect the state to grant them an extension, especially because they do have a replacement on the way. So they're hoping that that will fill that gap in the 3 years. They also mentioned that across the state, there are 250 hospitals right now that are out of compliance. Claudine?
Yes, certainly anything that doesn't create a lapse in services would be very important. All right. Thank you, Betty, for that report.